monteggia's fracture. Monteggia's fracture is a fracture of the proximal third of the shaft of the ulna, and this fracture should be associated with radial head displacement. So it is not just a fracture of the proximal third of the shaft of ulna, but also with displacement of the radial head, or in other words, the displacement of the radiocapitellar joint, okay, the joint between the radius and the capitula. As I said in a previous video, isolated fractures of the ulna is night stick fracture, but when associated with radial head displacement it is monteggia's fracture, okay. Falling down on outstretched pronated hand is the most common mechanism, but direct blow in the posterior aspect is forearm is uncommon but possible mechanism too, okay. So falling down on outstretched pronated hand, okay. There are 4 types of monteggia's fracture. In type 1, ulnar shaft fracture is angulated anteriorly. As we can see, this is the apex of the fracture. It's angulated anteriorly with the head of the radius in anterior displacement too, okay. In type 2, the fracture is, or the ulnar fracture is angulated posteriorly with the posterior head displacement of the radius, as we can see here, okay. So in type 2, posterior displacement and posterior fracture. In type 1, anterior fracture and anterior displacement. In type 3, we have lateral, okay, lateral displacement of the fracture in the shaft of the ulna and lateral displacement in the radial head, okay. In type 4, which is the least common type, we have both ulna and radius fracture, and we have radial head displacement, okay. So radial head displacement is a must in all types. Type 1 anterior, type 2 posterior, type 3 lateral with lateral displacement of the radial head, type 4 is both radial and ulnar fracture, okay. When we examine the patient, we have always to check radial nerve palsy. We have to do neurovascular examination to make sure that there is no compression or entrapment syndrome of the radial nerve. Actually, a radial nerve palsy, which is common, is a failure of extension of the metacarpopharyngeal joint, because extensor muscles of the wrist and hand is supplied by the radial nerve, as we can see here, okay. These are some x-rays of monteggia's fracture. Here we can see type 1 monteggia's, because there is anterior fracture with anterior displacement of the radial head. Again, type 1 anterior fracture and anterior displacement. Again, type 1. Here is children type fracture, because there is no real displacement or no apparent fracture. This is what we call a plastic deformation due to thick periosteum in children, okay. It may be the presentation in children, and also green stick fracture is common in children. Always remember to compare 2 limbs, because you have to detect that there is dislocation, and dislocation is not always apparent. Sometimes it is not visible, so you have to look for pain and tenderness in the lateral elbow joint, in other words, in the radiocapitular junction or joint. Treatment is done by open reduction and internal fixation, because you have to restore the length of the fractured ulna. Okay, once ulna has been fixed, radial head spontaneously will reduce. Okay, so you have to open, reduce and internally fixate the ulna with plate and screws, as you can see here. Once ulna is restoring its length, the radial head will be in place again. Okay, complications of monteggia fracture is malunion, failure of union, or non-union at all. Okay, mal or non-union. Nerve injury, radial nerve injury is a complication too, as we said. This is all about monteggia fracture. See you in the next video.